The team that I work with, they are so creative, so dedicated. And when COVID hit and the courtroom shut down, we did a good bit by Zoom, but you lose that face-to-face contact.
It was scary. You know, I'm kind of new at this, and it was really scary for me because I did not know how it was going to work. And I just could see like everybody just falling off and going out using and not showing up for court. But I think that they were afraid as well, that they weren't going to succeed. When the pandemic first hit, we started having Zoom meetings with the coordinators. Our administrator, Rebecca Provost Emmons, would set up weekly or bi-weekly Zoom meetings, and I heard one of the coordinators say that they were doing drive-through recovery court in a parking lot. So I said, wow, that sounds like a great idea. So I immediately called her and said, how does this work?
So we literally did drive-by recovery court. They would line up in their cars, we would mask up, they would mask up, they would drive by, we would have our interaction, and I would give them either their sanction or their reward and incentive. You still had that face-to-face.
So we've been able to do drive-through recovery court in the parking lot of two churches, one in this county and one in Murray County, the other county where we hold court. We've had meals provided, to-go meals. Church members have provided meals for our participants even through the drive-through court. That has been a good resource.
So we stood out in the cold, we stood out in the rain, and we had that face-to-face contact that is so important.
Once they saw that we were going to make this work, and we saw that we could make it work with the help of some others, then it turned out okay.
And this group stayed dedicated to and committed to recovery.
Through it all, they've maintained, and you see we've got 12 people graduating tonight, even in the midst of a pandemic, so I think that is awesome. You know, we were comfortable the way we were doing things. Now we've learned some new things. We've learned technology that we didn't know, and I wasn't really interested in knowing a lot, but I've learned some things that I didn't know. And so we're still able to do our Zoom meetings, you know, once a week, once every other week, and incorporate both groups. We're still using the social distancing rather than everybody piling up in the building during drug screening. That gives us one-on-one time. You know, they come in one at a time, and we get to have that little individual talk every day, just a touch base. And it also, they have learned, I think, the importance of being in the meetings. You know, some of them were kind of slack with meeting attendance and hadn't really engaged. And I think since they were not able to interact with other people, it's exciting for them now just to be able to go to the meetings, to come to court and actually sit in the courtroom. That was, you know, that's pretty neat. We had a guy that showed up for court last week that wasn't even on the docket, and he knew he wasn't on the docket. He just wanted to be in there with his peers. So it's really it reinforced for them the importance of that peer support and that peer engagement. And really, I think they value the staff members that much more because they see that we really care. We've gone above and beyond. We've made this work.